I have ankylosing spondylitis, which is inflammatory arthritis in my spine and in my hips. So to sit like this into a deep squat sometimes would have been incredibly painful for me. So I'm going to help you, if you have hip pain, know how to stretch. These are the 3 things that keep me flong and sexy. Number 1 is assisted stretches done one leg at a time. So wall is great for helping me to get into deep positions without having too much of my body weight going through my hips. So from here, I can rock forwards and backwards. This gets the knee moving, gets the hip moving nice and deep, and then I can change my upper body position, which is going to help me to get more external rotation, or if I turn away, I can get more internal rotation as well. Rocking forwards and backwards nice and gently, even if I need to use my hands to assist me, is a great way to get some gentle wiggles in. And basically what I'm doing here is working on my squat one side at a time. So if we look at this side, I'm here, knee over the toe, deep hip flexion, and I'm able to work on keeping myself upright, especially if my spine would be particularly sore because I have disc injuries as well. That way I can just working the hips without the spine having to feel under load as well. It is too warm to be wearing a jacket today. Whew. It doesn't need to be a wall, it can just be anything that you can get your leg up onto. So chair is totally fine as well. Number 2 is to actually put tension into stretches too. So whenever I'm down in this position, I can work gently on just pressing through my leg to slowly lift myself up. I want to feel this in the glutes and in the hips and not like I'm pressing through my knee. So if I was just pushing through my knee, I'd feel that too much in the joint. So I want to go down into a nice deep position, hold myself there, and just come up a little bit to make the muscles have to work. So this is great to work on the quads. And then simply by changing angles, I can start to work myself into isometric holds. So from here I can work on the adductors and just quite literally squeeze in as if I was doing that, but try and have a soft bend in the knees and squeeze in. And this starts to get a bit of tension into the muscles, which helps things to feel stronger, which can help to reduce your pain as well. So you don't just want to stretch, you want to lengthen and then strengthen as well. So after doing a few stretches like this, I want to then add in that isometric contraction to build that strength as well. I can also do that with the hamstrings. When I'm here, soft bend the knee, drag my foot backwards as if I was trying to do this, but it's stuck by the chair. So I can hold that and work on tension, and then I can even use the chair to press outwards to work on abduction as well. So this is working the side of the butt here. So I can hold that, both sides actually get worked, and I can just change where I'm at to get other angles. So it's so important with the hips to remember they're ball and socket joints that have large range of motion. So we want to actually make sure that we're getting into loads of different positions so that we can start to strengthen things fully. So there's no gaps essentially. So if you always do just the same stretches forwards and backwards, you're gonna miss stuff. So it's so good to vary up your stretches. Number 3, probably the most important point, when you're sore, you don't just want to try and rest completely because you're going to lose stability and things are just going to feel even worse. And then when you're starting to try and get back into exercising again, it's just going to feel so much harder. So reduce the intensity by using assisted exercises. And then when you feel good, it's go time. And it's so important to get yourself stronger. Weighted lunges are your best friend. You want to be loading things up and getting things stronger with extra weight so that it weighs more than you. If you only ever lift you become the heaviest thing you lift and then you become a problem. So when things feel good, start to use weight as you're training and that will help to keep things calmer, but also if a flare-up does happen, it will affect you less. If your body is stronger overall, there's less reasons for pain to be there. The last thing you want, if you have any kind of condition like ankylosing spondylitis, then you want to make sure that you're stronger so that the flare-ups don't hurt as much. Don't just stop with the light weights either. What you want to do over time is progressively load. So as this wee man gets bigger, I need to get stronger, and that is what's going to help me to keep pain-free. So number 1, use assisted stretches that feel easier for you to do so you feel safe, so you can actually keep consistent and not hurt yourself as you're moving. Second thing, make sure that you're adding tension into your exercises as well. So whenever you have your leg up on something, remember squeeze in or pull back to activate things, and also remember to go slow and pause through different positions. The whole way I'm going here with my knee, I should be able to pause and move my knee from side to side at any point and feel pain-free as I do that. Number 3, whenever you do feel good, make sure you're starting to add weights into your training so that your body gets stronger overall, so that your flare-ups affect you less. Let me know in the comments if there's anything that you would like help with or what you're trying to overcome, and I'll do my best to help you out. Over time, you can get yourself so strong and so mobile that people wouldn't even know that there was anything wrong with you. It's always worth getting yourself strong and flexible, or, as I like to say, flong and sexible.